Hello, my name is Jessica Peralta, and I am a student of UTRGV School of Nursing for the FMP program, and I am going to be performing my skills checkoff on the heart and neck vessels and peripheral vascular system. And this is Mr. Peralta, who will be my patient. And sir, do you okay the use of this video for education purposes and recording?
Yes, no
Thank,
problem.
thank you. All right, so I'm gonna go ahead and start with inspection and a general inspection of the patient. Sir, I'm just going to raise your pant legs a little bit just so I could see your legs and skin while I make this general assessment. So I'm just going to make a general assessment and check for central cyanosis. Right now I'm just inspecting the color around his lips, mucous membranes. Can I see your mouth? Okay, everything's nice and pink. Around the mouth is pink as well. I'm going to check for xanthelmas around the eyes. This is any fatty yellow lesions around the soft tissue of the eyes, and this usually will mean that there is a lipid disorder. In this case, you do not have any, sir. And then I'm going to check for annus senalis around the eyes, and I do not see anything of that sort either. And that usually will indicate a lipid disorder as well. Also, I'm going to check for retinal blood vessels. Can I look into your eyes? And this will, if there is any retinal blood vessels are bleeding, this usually will mean that there is some hypertension, changes in the vessels of the eyes. Now I'm going to look for peripheral cyanosis, and at this point I'm going to look at your nail beds, and they are pink, not blue. I don't see any clubbing as well, and this would mean that there is some hypoxemia that has been chronic, and you do not have any of that. I'm going to look at any edema and hair distribution, which is why I wanted to see the legs. I don't see any edema on the lower extremities. I do see that there is hair on the legs, and it is not patchy, and it looks generalized. I don't see any loss of hair on the legs. I don't see any edema on the feet or lower leg. Now I'm going to check and look here. Now just go ahead and kind of lay your head back and turn your head that way. And I'm going to check, just inspecting the JVP. And just kind of lay back a little bit more, and then just relax. There you go. Now turn that way. You with your head and lay back.
Yeah, like that.
There we go. Okay, and I do not see JVP. It's actually just right above the suprasternal notch. Now, I'm going to measure JVP. Just stay like that, please. And I'm going to get my tools. I'm going to take a ruler and a straight edge. I will get my pen in this case. And I'm going to just look at where it is. And just right above the suprasternal notch, I'm going to place my ruler and measure up. And I see here it is 2.5 centimeters, which is normal because it is less than 5. Okay, you can relax. Now I'm going to also look at the abdomen. And in this case, if you want to lay back a little bit, just kind of like so that you're a little bit more flat, if you can, a little bit, because I want to check for pulsations. There we go. And do I see any pulsations in the abdomen right now? No, I do not. And we always want to check for any abdominal pulsations, especially in the older gentleman, Caucasian, especially with history of smoking, because that could indicate a triple A, abdominal aortic aneurysm, and there should be screening. But in this case, we have a Hispanic young male, but all physical exams, we should always check for pulsating in the abdomen. So now I'm going to palpate the precordium, and I'm doing this because I want to check for any dextrocardia, any heaves, lifts, or thrills, and this could indicate any valvular disorders. And so at this point I'm going to just touch you if that's okay, and I'm going to make sure my hands are nice and warm, and before this I have washed my hands with hand sanitizer. So I'm just going to palpate the precordium, and I don't feel any heaves. So the second intercostal space on the right side would be the aortic. Second right would be pulmonic. On the left, I'm sorry. And fourth left would be tricuspid, and fifth intercostal mid-sternal border would be the mitral valve. And I do not feel any heaves, thrills, or lifts. Now I'm going to check for hepatojugular reflux, and I'm going to go ahead. This is done on the right side of the abdomen. Now, sir, I'm going to put some pressure on the right side of your abdomen. I'm going to push up. Now, what this does is if there's any right-sided heart failure, sometimes the heart cannot compensate for that, and I'm going to look on the right side to look at your JVP and see if that increases at any time for when I push. So on the right side of the abdomen, now look this way. There we go, and just relax. And I'm going to push. Okay, so I don't see anything there, and that's normal. And so now I'm going to check the carotid pulse, and I'm going to move on to checking pulses. I'm going to check the carotid pulse, and I'm going to palpate. This is done palpating one at a time. You cannot palpate both at the same time because you can actually cause decreased blood flow to the brain. So it has to be done one at a time. And I'm going to go ahead and palpate here. Okay, that's nice. Now I'm going to move on to this side. That's a beautiful pulse. Now I'm going to move on to palpate the brachial pulse. Now I'm going to borrow your arm. So brachial pulse is strong. Now radial, and that is strong as well. Okay. Now at this point also, while I'm here, I can check for refilling of the cap refill, and it's nice and brisk, less than 3 seconds, which is great. I can move lower, and this would be the femoral pulse. In this case, it would be done usually with no clothing on and the femoral groin area. Popliteal pulse here, and you kind of want to make sure that the patient is kind of relaxed, have a little bend in their knee, because if their leg is completely straight, it's going to be difficult to feel the popliteal pulse. dorsalis pedis here on the foot, and yours are nice and strong actually. And posterior tibialis. As well. So now I'm going to, I checked the cap Peripheral. Now while I'm at the lower extremities, I'm going to check for any pitting edema, and this is graded 1 through 4. So I'm going to push a little bit, and there is no pitting edema on your feet, but usually if there is any pitting edema, usually this means a type of heart failure, usually right-sided heart failure. And if there is edema only on one leg rather than both, this could mean some obstructive blood flow. You'd want to look for any DVTs or anything like that. Also, talking about DVTs, and while I'm on the lower extremities, I'm going to go ahead and check for Hoffman's sign. So the way that I check for Hoffman's sign is, I'm going to move my camera a little bit. I'm going to grab the leg. I'm going to dorsiflex the foot, and I'm going to squeeze the calf. And no pain? Okay. So usually if the patient does feel pain, I'm going to move on to this side. I'm going to dorsiflex, and I'm going to squeeze the calf. And you want to make sure that the leg is a little bit relaxed, not just super straight, because this can also cause some musculoskeletal discomfort. But when you squeeze the calf, you want to make sure that the patient doesn't have any pain, as this could be indicative of a DVT. Okay, and so I want to now discuss percussion. As in the Rhodes book, I read that percussion is actually a less reliable tool when assessing the cardiovascular system rather than inspection and palpation. So I'm not going to go and percuss on your chest. That's actually not recommended. But I do want to feel for PMI, and I'd like to just palpate here. And this will be on the normal heart, will be in the mid-clavicular, 5th intercostal space. And at times you'll be able to actually see it and feel it. And you can also check if the heart rate is regular and if it's strong, and I can actually feel it here. And that is the landmark for PMI. Now, lastly, I'm going to move on to auscultating, and I'm going to start up and go down. So I'm going to use my diaphragm and my bell to check for any bruise on the carotid. Now, squid and relax. Now hold your breath. Okay, good. Just one more time here. Okay, now the other side. Thank you. All right. So now I'm going to auscultate for the heart sounds, and I'm going to go to I'm going to start off on the right, 2nd intercostal, sternal border, and I'm looking to hear the aortic valve here. And S1 and S2 are appreciated. I do not hear any S3 or S4. I'm going to move across the street to the other sternal border, 2nd intercostal, left sternal border. chronic. And I'm going to move down to the fourth, the tricuspid. And then down to the fifth, mid-clavicular for the mitral. And I heard beautiful heart tones. S1 and S2 are appreciated, and S3 and S4 are non-existent. Usually when there is an S3 or an S4, this can mean heart failure, CHF, and valvular issues, and they were not appreciated. And that will be the end of my video for checkoff assessment. Thank you for watching. We'll see you in class.